DREDF, Healthcare Stories. Mary Delgado is being interviewed in an office at Access Living in Chicago, Illinois.
My name is Mary Delgado, and I live here in Chicago. And my disability is post-polio. A lot of younger people don't understand post-polio. Post-polio was an epidemic that happened all over our country, and I was lucky enough to be involved in one of the last ones in Texas. So that's what it affects my lower limbs for the most part. But now I have post-polio syndrome, which means it's affecting my arms too. My arms are not as strong as they used to be. First of all, I'm not knocking my doctor. My doctor is a great doctor. So she's a female, and I really like her. Is that only she is not like most doctors are not, even though they're in the medical field, she's not savvy about disability. And the office is, as always, the office, they put me in the biggest office they have, and it's not ever very big. So I never get out of my chair, and that's a choice that I prefer. But I've not been weighed. I have to always guess at my weight. I've not been weighed, let's say, for 20 years. So I've not been weighed, and they don't there's not even any attempt to weigh me. It's something they just gloss over, just don't even mention. So because there's no way to weigh me there at my doctor's office. My mother lost her breast to cancer, and so I need to go every year for my mammogram, and I go to the office is right across the street from the hospital. So I've been going to the hospital for my mammogram yearly, and it's interesting. I go there, I go to the receptionist. She looks at me like, "We can't help you," and I tell her, "Miss, I've been here every year. I've been here every year for 10 years." She says, "I don't think we can help you." And so she gets up, goes to talk to some upper person, and then comes back and says, "Oh, okay, come on in." But this is always the receptionist. The people in back don't have an issue. The actual techs, they don't have an issue with it. We just take care of it. The machine goes, really low for me, and there's no big thing. Now, pelvic exams, that or pap smear, that is a totally different story. They, I went, and which is because of my mother's history, I went 5 years without a pap smear because I could no longer get up on the table. I was the brave crip, the strong crip, and would climb up on tables. Came to a point where I could not do that anymore, and I just couldn't do it. And so I went 5 years without a pap smear, and again, my doctor just didn't ask about it, and I didn't bring it up. And then suddenly I said, "Mary, you're going to have to do something, you know." So I told my doctor I need a pap smear. She said, "Oh, you do need a pap smear." And then she said, I need one where the table's lower so I can scoot over there. She said, "That's a great idea. Find one." I looked at her like, "Excuse me?" She said, "Find one and I'll refer you. I'll refer you out." And so it took a lot of calls for me to be able to find a hospital, a newish hospital that did have these tables, which I found. And I came back to her and I told her, "Okay, this place has them." And she said, "Oh," she was very happy about it. And and I was like, I thought maybe this was something you should have done or helped me out with, but now I'm going. She refers me. I'm part of HMO, so she refers me out to a hospital that does have tables that go almost down to the floor, and which are great. So I have my pap smear there, and no big thing. No one treats me like anything else. The way my doctor dumped it on me, I don't really think that was my responsibility. I don't think she should have done that. She was taking the easy way out, but being a woman with a disability, it happens too often. Says, "Well, you can take care of it since it affects you," which it really, no, I don't think that was right. I hope, I came back to her and I told her, doctor, as much as we like each other, much as we know each other, that was not my responsibility to look for an accessible place. And she said, but you found it. So it's like, you know, I just, I, I, I had nothing else to say to her. I was like, okay, fine. Give me the referral. Tables, equipment, sign language interpreters, all of those should be just mandatory. And it shouldn't just be one table, one interpreter. It shouldn't be that. It should be more widespread throughout these places. And them being teaching hospitals are huge. They're huge. So it should be mandatory and they should be plentiful. Being a disabled woman is a lot of work, and it shouldn't be. It should be just as simple for us as it is for any other woman to get what we need. To other women with disabilities that have issues with their doctor, with their medical care, I, I want to say, I'm really sorry about this. You know what I mean? I'm really sorry that things have not changed for you. And I want you to I want you not to give up. I want you to get what you need because everyone should have medical care, have medical care like everyone else. I don't think because of your disability that you should be ignored, looked over. But it's going to be hard. As I said previously, being a woman with a disability is not easy. But it can it'll be all right. And hopefully, when my granddaughter is grown, and then her friends with disabilities won't have these issues. I hope. If I were in an elevator with the CEO of a hospital and I had just a minute to speak to her, I would tell her, level the playing ground. Let it be fair. Let me be treated like everyone else.
Healthcare stories. Made possible with generous support from the Manuel D. and Rhoda Mayerson Foundation. Mary Delgado was interviewed at Access Living Chicago, July 2011. For more information, visit the Disability Rights Education and Defense Fund website, dredf.org/healthcare-stories. This work is licensed under a Creative Commons Attribution Non-Commercial Share Alike 3.0 Unported license.